Recruity. I am the owner of Floss, and I wanted to introduce myself in these few informational videos that we're going to talk about brushing, flossing, rinsing, and general questions that I get about toothpaste. In general, I get questions about toothbrushes. Depends on the child's age. So if your child is an infant, you're better off with an infant finger brush or a small toothbrush like the one I'm holding. If your child is a bit older, anywhere between 8 to 11, then you want to get the age-appropriate size toothbrushes. I get questions about whether to use electric toothbrushes versus regular toothbrushes. Electric toothbrushes are great, but the things to watch out for. Your child needs to have dexterity. What does dexterity mean? They need to button their own clothes. They need to tie their own shoes. They also need to zip up their own jackets. Until they're proficient at doing that, getting an electric toothbrush might be a little bit cumbersome. In terms of techniques of brushing, I always tell most parents you want to do gentle circles. The main area that you want to get is obviously the tooth surfaces, but also around the gums. A lot of times plaque, which are sugar monsters, sits right at the gum line. So doing gentle circles is not traumatic to the gum, and you're getting all the plaque out. In the back, once the child opens their mouth or you're brushing for them or they're doing it themselves, this is the occlusal surfaces or the biting surfaces is where you can scrub. Also, don't forget the insides near the tongue or the roof of the mouth. And do not forget the soft tissue. The soft tissue is in regards to the tongue. The tongue is very important. It holds all the bad breath bacteria. So you want to either get a toothbrush that has a tongue scraper in the back or brush your tongue with your toothbrush. Flossing, which is the next topic. Most of us floss when we get food stuck in between our teeth. That is not the correct answer. Flossing should be done every day, once a day. And if you're flossing, you don't want to do a straight up and down motion. You want to do it a little bit at an angle if you're doing it with a pick. If you're using a string, it's even better. It curves around the curve of the tube. Toothpaste. I get a lot of questions on toothpaste. So the AAPD, which is the American Academy of Pediatric Dentistry, recommends using specific amounts of children's toothpaste as the child is growing and developing. So between 0 to 3, 6 months after the first tooth erupts, you can do a rice grain or a smear-sized amount of toothpaste. How much is that? So you take a little bit of toothpaste, and it's very, very, very little. That's a smear right there. When your child is between 3 to 6, you want to use a pea size, which is the vegetable pea. Just about that much. Over 6 years of age, things change drastically, which means that a lot of children start to get permanent molars in the back. A lot of children start losing their teeth. So recommendations will change depending on how many permanent teeth are in the mouth, how many caries or cavities your child has. All of that will change as time progresses, so you have to check with your pediatric dentist as to what they recommend. Next, we're going to talk about rinsing. So mouthwash is really, really important. All the way from 0 to 12, all the kids, they have either they're losing teeth, they're getting new teeth. Especially babies, we think about teething and new teeth eruption, but you get new molars at 6, you get new molars at 12. So mouthwash is an important part of the hygiene. A lot of children cannot spit out mouthwash, so I always get asked, what do I do? If your child can spit, you can obviously use any of the fluoridated mouth rinses. Act is one of them, but you can do any mouth rinse that has fluoride. You fill it up to the fill line, right up to here, and you take it out into a cup, you swoosh, and you spit. If your child cannot spit, what I recommend is using a gauze right here, and you just wet it. And then what you do is you wipe the surface of the teeth with that wet gauze. This is great for moms and dads that have young children where you're transitioning them from the bottle just to no bottle or bottle to sippy cup. It's good to at least wipe the teeth with a little bit of gauze or mouthwash.